Good evening and happy holidays, and we'll get started in just a couple minutes. So welcome everybody, and thanks for taking the time out of your busy days and potentially stressful days to join us for this edition of the Cancer Prevention and Wellness Talk. We're pleased to have Kerri Susko, who is a clinical social worker at Prisma Health. She is the director of the Cancer Support Community and does individual counseling within the Center for Integrative Oncology and Survivorship. And she's going to talk to us about the mindful management of stress, which is very apropos given the season, given the last 2 years of pandemic and all the stress that has occurred with that. Although we're doing it more from the standpoint of a malignant diagnosis, both as a patient and as a caretaker. Just some housekeeping, routine issues. Everybody on the call will be muted. The chat feature is in play, so you can certainly ask your questions via that mechanism, and we'll be monitoring that. So hopefully Kerri's talk and our conversation will generate some questions. The other thing is all of these talks are recorded, and within 24, 48 hours, certainly within next week, they'll be available on the Cancer Survivors Park website, which is Cancer Survivors Park, all one word, .org. So if you'd like, you can look at this again, as well as tell friends about this. We do see a lot of people that go back, and other people that have looked at these monthly talks, not at the time that they were actually given, but later on. So without further ado, Kerri, good evening.
Hello. So this is apropos in another way, because obviously I am not being seen, and I have tried to be mindful today as I've gone through several different computers and tried to use my own tools here that I'm going to talk about. But anyway, I apologize for not.
So
for you
Kerri
all
is
not seeing
actually
video.
doing some diaphragmatic breathing right now. So all that's good. So we have had our share of computer issues as we've done these things virtually. But still, I think most of the information is imparted, and most people get benefit from it. So one of the things that we announced you as is the director of the Cancer Support Community, and if you want to just kind of let people know what that means, what it means locally, what it means nationally, and how we get involved with that, just kind of as a summary.
Sure. So the Cancer Support Community is actually the largest nonprofit organization providing social and emotional programming to survivors. And when we talk about survivors, we're talking about not only individuals who are diagnosed with cancer, but their family, their friends, caregivers. Everyone is affected by a diagnosis. So the programs from CSC are open to well, I guess unfortunately, pretty much everyone in the community, because most everyone either knows or has known someone who's had a cancer diagnosis or has one themselves. We were the first hospital to partner with Cancer Support Community. The corporate office is in Washington, but we were pretty proud to become part of it. And we've been offering programming for about the last 10 years. There's 4 elements to our programming: healthy living, like this class is about healthy living. We have social events, we have support groups, and we have other educational offerings. So,
and I think we just had an event prior to this lecture from 4 to 5 about, you know, Christmas holidays and stress and dealing with that as well. So,
yes.
And obviously a lot of stuff about, you know, trying to eat healthy, a kind of an anti-cancer preventative lifestyle. But one of the things that obviously comes up, I mean, you're living your life and minding your own business, and you get a cancer diagnosis, and things get disrupted. And it's not to say necessarily that stress had anything to do with necessarily the malignancy, but it's got a lot to do with how you manage it. And so, you know, some of the things that that you want to talk about from the standpoint of the mind-body experience.
Mm-hmm. Yep. Yep. I hope that's what we're going to do a little bit of tonight. So do you want me just to
go ahead.
get into it, Dr. Giguere?
Yeah, by all means.
Okay. So obviously, as Dr. Giguere mentioned, we're going to be talking about managing stress. And first off, so here we are. But the question is, are we really here? Meaning, oftentimes we are present physically, but we are not exactly all there, so to speak. Our minds are full of all kinds of other things. I think this is a good visual of it being filled with all kinds of planning, things that have happened earlier in the day, thoughts of what's for dinner or what we have to do tomorrow, difficulties with other people. And it's really, really hard to just be mindful. So you can see this little doggy in the visual having sort of a peaceful mind, but he still has stuff in there, right? Meaning our minds are never blank. And I think one sort of myth or thing that sometimes we hear from other people is let your mind just go blank. And the fact of the matter is that's pretty impossible. I don't know. I've never been able to have just a blank mind, but we can have a mind that is singularly focused. And when we have a singular focus, that feels a lot better than having all this clutter like this person in the picture has. So I want to first talk about what is mindfulness. So mindfulness, one definition is paying attention on purpose in the present moment, non-judgmentally and with kindness. And that's sort of the guru of Western mindfulness, John Kabat-Zinn's definition, but that's a heck of a lot of words, isn't it? So let's break it down a little bit. So paying attention on purpose. This is intentionally becoming aware of thoughts and emotions and sensations in the body. These things are messages that would be really helpful if we paid attention to them. And being in the present moment. So bringing an open and receptive awareness to the experience without predetermining anything, aware of what you're doing while you're doing it. And then we have non-judgmentally and with kindness, two pretty difficult, even strange things for some people. But that means coming into an experience without expectations, without predetermining how something's going to be, and not letting our own likes and dislikes, opinions, prejudices, projections sort of get in our own way. And when we do this, it really opens us up to new possibilities. And this can really change life by changing the way we view things moment to moment. It really makes a huge difference.
So it's fair to say that sometimes we can be our harshest critic. And
Absolutely, yeah.
And obviously I really want to emphasize being kind, but also when you first start out in this, when you first start doing the mindfulness, you may kind of be harsh with yourself that you're not getting it. You're having too many thoughts, or and so it kind of defeats the purpose. And I think to a certain extent also we come from a culture where we're kind of encouraged to downplay our emotions, and so it's really, really important to get away from that theme and really be kind. Kind is a great word. Empathetic, grateful, hopeful. So yeah, and I just wanted to kind of emphasize that.
Yeah, and I think you're bringing up a really good point. We'll talk more about it later, but the fact that oftentimes we think there's a right way to do something like meditation or being mindful. And part of the actual way of doing it is just being aware when you're not doing it. So, when the mind starts to wander, to be aware that there it goes again, into at times when we can bring it back. But that's certainly part of the practice. And I think that people do get caught up in, if I'm not completely present and something isn't happening, then I'm not doing it correctly. Right. And so hopefully tonight we'll really focus on the fact that is false, and that being mindful is informal as well as formal.
You can't do it wrong.
Can't do it wrong.
Okay.
And doing a little is better than doing none also. So, this concept is really nothing new, right? This has been around for thousands of years, initially in Eastern society, but obviously now more mainstream in our society. I never heard the word mindfulness growing up, but sort of here we are with it splashing on all the magazines and us doing these talks, and that's good news. So the good news is that it's actually really simple. It's accessible, it's free, right? But as accessible as it is, it's not easy. So that's sort of the bad news, that it does take practice, but like any muscle, over time, we sort of get stronger with it. So I wanted to just take a moment and take a breath and have everyone paying attention to a few breaths, taking a moment just to relax and feel wherever your breath is most prominent for you, without manipulating or changing it in any way. So if you feel the cool air coming in through your nostrils, warm air going out through the nostrils, or the chest, if that's most prominent for you, rising on the in-breath, deflating on the out-breath, or in the abdomen with the abdominal wall rising on the in-breath or deflating on the out-breath. And just taking a moment to focus on breath. So just in that one moment, I don't know how it felt for you all, but that calmed me down. And I feel more present just from that moment. That simple act of breathing attentively sort of led me back to being here and being calmer. And like I said, I was sort of running around all day and trying to figure out technology, and that really helped me. And that was a minute, not even a minute. So that's something that we can do at any time. That's, yes, we were doing it in a formal moment together, but you're always breathing, right? And taking that moment, taking that pause is super important. It's really the seed of mindfulness. Most stress originates from our thinking, us thinking about the past or the future. That creates a lot of angst. And when we are in the present moment, a lot of that angst falls away. And this may seem hard to believe, even in the midst of life crises like a cancer diagnosis, but I really encourage you to see if it works and to check it out just intermittently throughout the day. So let's talk about why it works. I mean, we have a stress response. We all know that stress manifests itself in a variety of ways. And if you're not on the phone and can see this slide, it lists some of the different ways. Physical symptoms such as headaches, sleep difficulties, tightness, racing heart, fatigue, emotional symptoms like anxiety, feeling overwhelmed, anger, irritability, cognitive symptoms such as forgetfulness or lack of problem solving, trouble thinking clearly, and of course, behavioral symptoms like a critical attitude of self or others, inability to get things done, increased consumption of food or alcohol, smoking more, spending more. So it's important to get acquainted with your own stress response, and identifying your own patterns help you to become more aware of instances where you need to take action. And certainly a pause is an action. We'll talk more about what else a pause does, but being able to stop the trajectory of our stress response from increasing, of course, that's going to help when we don't keep piling on stress, right? If we have a stressor and then we can keep it at the same level or even bring it down, we don't have stress after stress after stress that just by the end of the day is overflowing our cup. And the sooner that we can attend to it, the sooner we can get back to a better space. So, if you get on a train and go 2,000 miles, it's a lot harder to come back that 2,000 miles than if you catch it at 10 miles out. You get back quicker and you're probably in better shape.
It is a situation where the stress response is kind of hardwired in us. I mean, evolutionarily, it's fight or flight,
Yep.
or sympathetic nervous system. It was there to get away from the saber-toothed tiger. But what we're talking about now is kind of not having that constant chemical, that toxic chronic stress and chemical imbalance. That sometimes is something that physiologically can alter it, not to necessarily think that it causes cancer, but it can alter the milieu that the cancer exists in so that it may be harder to treat it.
Mm-hmm. Yeah.
So where does stress come from? Yeah, it's kind of hardwired in us.
Right. Well, it is, and you're right about the sympathetic nervous system. However, we do have ability,
right?
Again, albeit very challenging at times. And certainly when we are not feeling well, when we have more stuff going on, it is more difficult, but we can balance it out with the parasympathetic. And this is really what mindfulness is about. Oftentimes we're thinking that stress is more external than internal. You know, there's so many doctor's appointments, there's difficulties in society and politics, we have daily demands, relationships. You know, each of us would probably identify an external stressor as something different, and certainly we all have those. But that's the part that we don't have control over for the most part. But yet we often get caught up in the battles to try to fix those things or change those things. And it's interesting how we allow ourselves that. And then sort of what you were pointing out, Dr. Giguere, is that we have this internal stress. And yes, there used to be saber-toothed tigers, but well, I guess they've turned into other things. But you know, our internal stress, the way that we're relating to those external events, that fight or flight, our internal dialogue, how we're talking to ourselves, what we really don't want to acknowledge or accept, you know, how we sometimes shut down, and also how everything that we have gone through ends up flavoring different experiences and are not being aware of that. So you may have noticed other people who seem to deal with things better, who maybe don't get as caught up in events and thinking. And I put out to you that they probably still have external and internal stress, but they know how to manage it, or they found ways to help themselves manage it better. So being more aware of how you react to stress, becoming aware of your own patterns, and understanding that you do have a choice in how you respond and how you can manage it is mindfulness. So let's talk a little more about managing it, and managing it through a singular focus, such as breath. Again, I'm bringing up breathing, not because that's the only focus. There's a million different singular things to focus on.
Right.
But I'm bringing it up because you're always breathing. Again, it's present for you to go to, even though that doesn't make it easy to go to. But I put up this keep calm and respond. I guess that was the first one, and now it's keep calm and everything else, but we're going to look at keep calm and respond. So if I am focusing on my breath and the process of breathing, not changing my breath in any way, but if I'm focusing on one thing, it helps to dissipate all that clutter. It helps to give me a break. And I know that most people don't get breaks anymore, but the intention of a break was to be able to step away, regroup, and to come back and be more effective. And that's what I'm talking about here, is coming back and being more effective for ourselves. When we're able to take a break and not think about, and let's face it, a lot of our thoughts have some anxiety or stress associated with them. Even when we want to do things, like maybe you wanted to get on this call tonight, but there may be technological difficulties. I may have had to rush from work and deal with the traffic. There's things around even thoughts that we are pleasant that we have to deal with. So when we're thinking about something that doesn't have an element of anxiety or stress to it, naturally our bodies and our minds calm down. And when we're calm, we can sort of step back. It creates more space and we can see some options. It allows for us to see choices. It allows for us to see those windows and doors and make a decision on which one we're going to go through instead of just falling through the first one. So we're talking about responding versus reacting.
You know, and the other thing is, and for people who are on the call that may have had a cancer diagnosis, they may be surviving, they may be dealing with a new diagnosis, but also I think this really applies to the caretaker as well, because everyone, I think there's more and more family members that are involved in that responsibility. It may be for, you know, a spouse or a child, or more frequently with an older a parent or whatnot. And I think that process of giving a break and accepting help and just you'll be much more effective if you can take care of yourself and you just don't feel worthy because you're not the patient. And it's going to be very important for whoever's on this call to, on the recorded version, make sure your caretaker or somebody who's in that process with somebody that gets these concepts as well.
So thanks, Dr. Giguere. To make a more tangible point, those of you who can see this picture, I want you to focus on the picture, and I'm going to ask you, Dr. Giguere, for some help here.
Okay.
Can you just, for those who can't see this picture, describe it with the colors, with the whatever you see in terms of textures, color, everything on there?
So it looks like a blue, somewhat distressed antique table, maybe on a outside porch at a house. It's a beautiful blue picture. There's some yellow apples and some other, red fruits on the table, and a flower arrangement of some red and pink and white, what look like to be carnations. And look like a lot of weather is going on. There's not any sense of any movement. It's very still.
Okay.
Yeah.
So, Dr. Giguere, while you were telling us about that picture, what else were you thinking about?
Just that picture.
Okay. So that's the point, right? That if I am focusing on something intensely, it's really hard for me to be thinking about who aggravated me this morning and what I have to do next and whatever it might be. So again, our minds are never blank, but if we're focusing on something for a few moments that is pleasant or calming, or gets us out of a thought trajectory, that can really help for us to make a choice about how we want to proceed next. Okay. So I hope you all see where I'm going with this pausing, and then moving forward intentionally with a choice. Again, I keep reiterating this, but I'm going to say again, although this sounds reasonable, perhaps maybe even simple, it is very difficult to implement. And one of the reasons that it is difficult to implement is because a lot of times there's discomfort that we are having, and we don't want to be in the place that we're in. And so instead of pausing, we are flailing around. And this picture, well, it's supposed to be someone in quicksand. We start doing all kinds of machinations to get out of the place that we're in. And like quicksand, instead of helping us to get out, it sort of sinks us deeper into the situation. So almost in a paradoxical way, our attempts to get out of something or get rid of feelings or think our way out of it, or get out of wherever it is and into someplace else, we sink deeper. And in fact, this is really what our minds often are doing. We're trying to solve a problem or get things done. And this is the doing mode of the mind. But it often doesn't serve us well in terms of emotional wellness. So learning to recognize when we are in those spaces and we are doing as this society promotes, for us to come back to being and to moment by moment experience can feel a lot better. It helps us to cultivate emotive mind that allows us to respond more skillfully to whatever is happening, and just be present and allow for what is to be. So let's talk a little more about just doing versus being. So when we're doing, we can be in automatic pilot. So oftentimes we're walking, we're driving, we're eating without really even any awareness of what we're doing. I'm sure you've driven places where you've driven several miles and where was I? I don't even remember being there. So being is really living with a conscious awareness and making a choice, choosing our next step and inhabiting the present moment. If we're doing, we're relating to experience through thought. And yes, thinking is very important, obviously. It helps us get things done. It helps us be creative. It helps us make discoveries and fix things. However, if we're only thinking about things, thinking about feelings and sensations, our minds are full, but it's really, life is really with a veil of thoughts that filter out a lot of life's vibrancy and energy. Whereas if we are being, we are experiencing life directly through all of our senses, and we can feel much more connected, engaged, and experience it in a very different way. Doing is sort of dwelling in the past and future. Again, many of our thoughts are about things that have occurred in the past, and we can get caught up in those if-onlys. We can also get caught up in worrying about the future. And certainly many of the clients that I talk to, that's a huge part of their difficulties, that anxiety about recurrence, about what's going to happen. What if this? What if that? What's that scan going to show? So if we're being in the present moment, that's where we really have any control at all. When we are in the present moment, we can focus on what is within our control. Because when we're out of it, when we're thinking about past things or into future things, those are two spaces where we don't have any control, and that can lead to heightened depression and anxiety. As we just talked about, needing to avoid, escape, or get rid of an unpleasant experience, that's a natural reaction. But when we try desperately to get out of something that no matter what we do is going to be as it is, we just keep expending energy in a non-productive direction. So being able to approach things with interest, even if they are unpleasant, and allowing things to be as they are, can really help us to decrease our level of uncomfortable emotions and stress.
So in your individual counseling, I think that there is a voice from our society that basically rewards the treadmill, hard charging, accomplished, 100-hour work week people. And, obviously we are understanding that that is not sustainable. When you're seeing people that have, it could be a cancer diagnosis, it could be any kind of chronic disease. Do you find that it's easier for them to go from this doing to being transition, or is it still something that's kind of ingrained that you have to kind of work at? And I'm sure I don't want to generalize it, but has the diagnosis made that transition a little easier for you and for them?
I don't think that it makes the transition easier necessarily, but I think that there is a perhaps greater desire in a lot of people to not be as stressed. So they put more work into it. They practice it more. They are open to the work, whereas maybe before other things seemed to take the number one important stance. So I think just the openness to it, the receptiveness to maybe there's another way for me to do something. I think that's the difference.
Okay.
And I think I've relayed this to some of you, but when I first moved here and heard one of our oncologists speak, and someone asked him, why did you go into oncology? Isn't that a really difficult profession, discipline? And he said, well, I love it so much because so many people become their best selves after a cancer diagnosis. And I think that's what we're talking about here. The openness to make changes, the openness to look at something differently, and just different perspective, right? This is giving different perspective, and not one person who's gone through a diagnosis doesn't have a different perspective already.
Yeah.
Yeah. So going back to just the last couple of things on here in terms of doing versus being, and again, Dr. Giguere, you said it so well that our society promotes tasking above all else, right?
Yeah.
And we really have to get off the moving sidewalk to start just allow ourselves to be. But seeing thoughts as true and real, we often view thoughts not as mental events, but as something that is real. And if we can instead see them as mental events, just as things that come and go, it really helps us to not grab onto them and not get stuck and ruminate over things. I don't know if that makes sense. I don't know if everyone understands what I mean by ruminating, but when we grab onto something and hold it really tight, again, those are often the things that we're trying to let go of. An example of that would be if I'm trying to go to sleep and I know I have to get up at 5 in the morning, but I can't go to sleep. And I just keep saying to myself, oh my gosh, I have to go to sleep. This is horrible. What time is it? And I keep sort of holding on to it. It keeps it right there. Whereas if I would relax and sort of let it be, let it go, then I'm able to probably fall asleep because I'm not stimulating myself with my own thoughts. What I'm trying to get at here is a lot of the way we allow our minds to take us away is self-defeating. So if we can be more of an observer and not get so entangled in our own thoughts, we can use a wise mind and with some clarity make a choice on what we're going to do. The last thing on here in terms of goal attainment, I just want to say that oftentimes we're so caught up in attaining a goal or tasking or things that we think that we have to do that we give up on activities that actually nourish us, that actually feed our inner resources. And when we are involved in all that tasking, we can become very depleted. So I wanted to take just a moment and ask people to take a moment and think about their normal activities on a given day. And just think about maybe 5 or 6 things that you do. And then I want you to think about whether those activities are nourishing And when I say nourishing, I'm talking about that give you energy, that give you positivity, that put you in good space? Or are they depleting? Do they sort of suck you of energy, drain you, not make you feel good? And it's interesting to just take note of that, because so many times, and when I have asked clients to do this activity, they notice that many of their activities and many of the things that they are doing are depleting. And although there certainly are things that we have to do, we don't have a choice about it. There are ways that we can tweak things that we have to do so that they give us more energy. Or if we can't tweak them, are there things that we can incorporate that are going to nourish us so that there's a balance there? And this is another important part of mindfully managing stress, that we are aware of where our energies are going and making choices about where we're going to put them. For example, if I spend the next week putting my energy into worrying about what my scan is going to show, all that energy and all that time has not changed what happens at that scan. But if I use that time to enjoy my family and be present, that still doesn't change what the scan shows, but I've had 7 days where I've had a higher quality of life. So I sort of challenge you all to just think about that, to think about where you're putting your energies, and to maybe explore tweaking that. And I mean, one way to tweak something is just to be more present. For example, I have an old dog. She goes out to the bathroom multiple times a night. And that can feel very unpleasant to have to get up in the middle of the night and take the dog out. But I can also go out and I can be present in a different way, and I can relate to it in a different way, and I can look up at the sky and I can be really happy that I had that opportunity to see the constellations and to be out in the crisp air. And that really makes a difference in my emotional state, and my overall well-being. So nourishing versus depleting. I feel strange not opening things up for questions, but I guess I'll move forward and then we'll just have some questions at the end if anyone has any questions or comments.
There's nothing in the chat room right now, and
Okay.
We are at 6:20, so
Okay.
we probably ought to come down the home stretch just to make sure we're keeping mindful of their rest of their evening.
Okay. So just sort of as an ending remark, practice, practice, practice. So there's a difference between formal practice, certainly. Sitting, mindful movement, like walking, yoga, mindful eating, being involved in meditation groups, or, taking a certain amount of time for a meditation at home in a particular space, very intentionally. And that creates a great practice for using this informally. And really the emphasis on tonight, and what we've said, is that mindfulness is an informal practice. It can be used anytime, anywhere, and it can be just moments of time that make a huge difference overall. So yes, formal practice is important in terms of getting into a routine, in terms of the ease. When we practice anything, it becomes easier and we can grab onto it more readily. But this is to say that if you create small moments for yourself intermittently throughout the day, wherever you are, and if with those moments you are able to relate to things differently and use a wise mind to move forward, that there's going to be a higher percentage of time where you're in good space. And this isn't a fix. This isn't to say that if you are mindful, you're not going to have any problems. But this is to say that hopefully using a singular focus, taking moments to pause, responding versus reacting, nourishing yourself versus depleting yourself. These are things that can minimize stress and minimize not only how we respond to external stress, but that internal stress as well. So I will just leave it at that. The last I have a poem up here, which is called The Guest House, and I'll read it. This being human is a guest house. Every morning, a new arrival, a joy, a depression, a meanness. Some momentary awareness comes as an unexpected visitor. Welcome and entertain them all, even if they're a crowd of sorrows who violently sweep your house empty of its furniture. Still, treat each guest honorably. He may be clearing you out for some new delight. The dark thought, the shame, the malice, meet them at the door laughing and invite them in. Be grateful for whoever comes, because each has been sent as a guide from beyond. And so with that, I guess we can just end on, if we are open and receptive to whatever comes, and even if we don't like it, we can allow it. And that's not to say to give into it, but to allow it for the moment. Then we're not fighting against ourselves. And I guess there's enough fighting outside of us, and we can control to some degree, and as best we can, the fighting within ourselves.
Well, that was awesome. We do have a comment and question. Kathy has a comment, and I'll just go ahead and read it. I know it helps me respond and make better choices. Being a cancer patient as well as a caregiver, I have found it immensely helpful. Does not change the diagnosis or the path I am walking, and I still get sad, but less overwhelmed. I can make better decisions, which I think is really very well and eloquently stated. And then just the nuts and bolts of it. Are there any? It's technology. So are there any phone apps to suggest for mindfulness?
Yeah, I know that a lot of people I know use Calm, which has different meditations on it. I actually, I don't know the names of a lot of them, but we can get that information out to you.
Let me just see if there's any.
I just will throw out that there are certainly on YouTube, there are, I'll mention a couple different practices that can be very helpful initially. And I would trust Pat Rockman, John Kabat-Zinn, and David Siegel. if you see them doing any of those, but there's a lot of people doing this online. But checking out a body scan, which helps to to become more aware of one's own body sensations, that can be really helpful in, if you're aware that you're starting to get anxious, then you can do something about it quicker. So those are just messages that you're being told, like, okay, wait a minute, slow down or calm down. So a body scan might be something to check out. Also, there's breath, it's called breath and body meditation, where it just helps you to focus on your breathing, and also the sensations of your body. And then one other thing that I might encourage you to check out is, and I do this frequently in our meditation group, but it's called a metta meditation or loving kindness meditation. And it just encourages positive energy and compassion, cultivates kindness for yourself and for others. And certainly in these difficult times, we can all use having both compassion for ourselves and more compassion for others.
And Kathy has mentioned a free blog and meditation guide. Tara Brach, B-R-A-C-H, on Spotify or elsewhere. She posts blog discussions and meditations every week. So Tara Brach.
Mm-hmm.
So Kerri, thank you so much for that. I think it comes at a very apropos time in our world, in our life, and what we do with the practice of taking care of people that are going through difficult times and their caretakers. And I think this is a really important technique that allows people to not necessarily be conquered by, I don't know that it's necessarily a situation where we have to be Pollyanna with a positive attitude, but it's just important that it doesn't, the stress and fear doesn't conquer you and stress you further.
Yep.
So next month, no break, we will have the Prisma Cancer Institute dietitian Finley Nadler, who will be talking again, you can't hear it too many times, about plant-based medicine, plant-based diet, as well as her techniques for trying, when all around you is telling you you can't, how to maintain a healthy eating pattern in our culture, in our world. So I will say with that, happy holidays, along from the standpoint of not letting fear conquer you. I'll end, and Kerri's already shared a beautiful poem with you, but this is called Invictus, and I think most of you have heard it. It's by William Ernest Henley, and it was something that tell me the name of the Nelson Mandela, basically recited every morning when he was in prison. Out of the night that covers me, black as the pit from pole to pole, I thank whatever gods may be for my unconquerable soul. In the full clutch of circumstance, I have not winced nor cried aloud. Under my bludgeonings of chance, my head is bloodied but unbowed. Beyond this place of wrath and tears looms but the horror of the shade, and yet the menace of the years finds and shall find me unafraid. It matters not how straight the gate, how charged with punishments the scroll. I am the master of my fate. I am the captain of my soul. So thank you all for joining. Share with the recordings, and we'll see you next month. Good night.
Thank you.